I'm Craig Blumenshine, and today we air our second edition of A Closer Look with the Monitor. It's our weekly discussion with reporters from the North Dakota Monitor on current topics that impact our lives right here in North Dakota. And you can always read the Monitor's great reporting without paywalls or restrictions at northdakotamonitor.com, and subscribe to this podcast, A Closer Look with the Monitor, wherever you get your favorite podcasts. North Dakota is on the verge of one of the most significant healthcare overhauls in the state's history. The state's already secured $199 million for 2026 through the Federal Rural Health Transformation Program, created under the One Big Beautiful Act. The program guarantees North Dakota at least $100 million a year for 5 years, but state leaders say their goal is to reach $1 billion by the end of the program. The program requires swift action. Federal law gives the state until October to obligate where all this money is going and until the end of the year to spend it. Any leftover funding will be clawed back. Next week, lawmakers return to Bismarck in a special session to appropriate the money and pass several policy changes needed to keep the federal dollars flowing. To help us make sense of all of this and what's at stake and what the changes mean for rural North Dakotans, what we actually might see, we're joined by Mary Stoyer. She's the capital and policy reporter for the North Dakota Monitor. She's been following the state's preparations closely, including briefings this past week. Mary, welcome back to Main Street.
Hello, thank you for having me.
Mary, listeners may not be familiar about what the Rural Health Transformation Program is, or might be hearing about it for the first time. What exactly is the program, and why is it such a big deal for North Dakota?
Yeah, so like you said, the program was approved last summer by Congress as part of its reconciliation bill, and it's promising every state between $500 million up to $1 billion in grants to improve rural healthcare. And it was pitched as a way to offset losses to rural areas that'll come from federal cuts to Medicaid. So it'll only replace a portion of that money, but this grant program is intended to take some of the sting away, as well as North Dakota's hoping it'll be an opportunity for it to improve healthcare access in its most rural areas, and kind of improve some of its conditions related to like healthcare technology infrastructure, workforce, healthcare access, and healthy lifestyles for residents.
Mary, the state's, of course, been awarded the nearly $200 million now. Is it realistic that we might hit $1 billion over the lifetime of the program?
So the state isn't promising anything because it doesn't really know, but it seems to sort of have hit that target for its first year by getting nearly 200 million. So if things sort of stay the same over the next 4 years, it could reach nearly 1 billion, but they really won't know until four years from now, I suppose.
What projects or priorities are emerging, Mary, from the meetings that you've been attending here in the last week?
The State Department of Health and Human Services says its overall targets for individual categories for spending that money will be about 33 million for grants related to technology, about 116 million to expand healthcare access in rural areas, about 32 million to address workforce issues, and then about 17 million to promote programs that encourage healthy lifestyles. So those are obviously very large categories, and then the various things that money can be used for are too many to count, but those are sort of the broad categories that Health and Human Services has come out with.
Governor Armstrong interestingly said that the goal is to reach providers who usually don't apply for grants or feel left out of federal funding. So what kind of organizations is he talking about?
I think he's referring mostly to rural organizations that maybe don't have the resources to go after grant money ordinarily. In a press conference last week, he specifically singled out tribal communities. They're trying to hire a specific liaison to help tribes apply because their legal status is so unique. They're thinking that they might need a little extra help making sure they comply with federal requirements so they can take advantage of the money. So I think tribal communities and then any sort of rural organization, that isn't ordinarily a beneficiary of federal programs, they're really encouraging to apply.
I'm Craig Blumenshine, and Mary Stoyer is my guest on this second edition of the Closer Look with the Monitor. We're talking about rural healthcare transformation. Mary, lawmakers will return now for a special session next week. So, what exactly does the legislature need to do to unlock or protect the funding?
It's the legislature's job to set the budget. Usually, they'll say this when referring to Congress, but you might have heard people say lawmakers hold the purse strings, and that, of course, is true for North Dakota too. So they already set the budget for our current budget cycle that spans 2025 through 2027 last year. So they need to come back for a special session to add this federal grant money into that budget to make sure that the state has the authority to spend it so they can get it out to the hands of organizations in time to benefit North Dakotans.
You can read Mary's reporting about all of this, of course, in the North Dakota Monitor at northdakotamonitor.com. Mary, you've reported that 4 key policy changes will be considered. What are those proposals and why do they matter for the federal application?
So when the federal government um, started reaching out to states about this program, they told states that they could get more grant money if they enacted certain policies. Um, and so the legislature agreed that it'd be willing to enact 4 of these suggested policies in order to help North Dakota get more money from the federal government. So getting that money is eventually contingent upon the legislature actually following through with that. But for now, the 4 policies that the legislature is considering adopting during this special session related to that are: one, requiring K 12 students to participate in the federal fitness test; requiring doctors to undergo 1 hour of continuing education related to nutrition and healthy eating; adding physician assistants to its medical licensure compact. And then the last one is giving pharmacists more prescription authority that would allow them to prescribe medication to people to address common illnesses, as well as allowing pharmacists to order lab tests.
Mary, I remember during COVID times, there was tension in Wyoming about what the governor wanted to do and what the legislature thought should be done. So, is there any tension that you've recognized between legislative leaders and the executive branch on how fast this money needs to be appropriated and how it should be spent?
So I think the general tension I'm sensing more of has to do with the deadline pressures. I think everyone is sort of on the same page that they want to get this money out as fast as possible within reason. I think when they were preparing the application, there was a lot of noise in that so many different people had so many different ideas. And so there was a lot of complicated conversation about, like, what do we want this money to be used for? How do we distribute it fairly? Stuff like that. But I think now the executive branch and the legislative branch, now that the application was complete and submitted, I think everyone seems to be working together. It's just the deadline is coming up really close.
I thought it was interesting that HHS Commissioner Pat Traynor emphasized that unused money will be taken back by the federal government. So, how big of risk is it that the state will underspend, and how is the state preparing, I guess, to avoid that?
They're really trying to encourage people to apply quickly, and it seems like they're also trying to make sure that they give organizations the resources to know how to apply. But the deadline is in the fall for them to commit the initial tranche of funding, and then they have to spend it by the following fall. So they're really emphasizing that they only have a matter of months to process the applications and make sure that they're submitted before they promise the money to certain organizations. And then um, the recipients have to be prepared to spend it pretty quickly thereafter.
How do we know, Mary, in the end, that the money is spent as it needs to be? What reporting or performance measures will the state need to show in order to remain eligible for maximum funding?
I'm not familiar with the specifics on how they're measuring the spending. I do know that when they assess the applications, they're really looking for programs or purposes that can last beyond the span of the grant program. So they're looking for sustainability, which is kind of a complicated criterion. But then they can't spend the money on stuff on programs that already exist, in that they can't like supplant existing funding. And then they have a whole list of other requirements for people to be eligible for the grant funding in the first place. And then I also know that the federal government has to review and approve every single application for grants that the state wants to give out. So there are certain degrees of review there.
We're visiting with reporter Mary Stoyer of the North Dakota Monitor, talking about how North Dakota is racing to secure nearly $1 billion in federal funding to strengthen rural health care. It's part of the Rural Health Transformation Program, and that's what the upcoming special legislative session will focus on, learning what providers and patients maybe can expect as the state works to reshape rural care. And this is, of course, part of our second episode of our now weekly podcast, A Closer Look with the Monitor. Mary, for rural residents, let's say farmers and ranchers and folks who have to drive to the nearest clinic, what is HSS hoping to accomplish, do you think?
They really want to, I think, make healthcare access easier in those areas. So they're looking at ways to kind of um, expand treatment options. I mentioned before one of the policies that they're looking at is allowing pharmacists more authority to prescribe things and to order tests. They're also trying to make it easier to hire people, with the hopes that I think they're able to staff up workforce in those areas. It's really hard just with the scope of this grant program to describe the full scope of what they're considering and how the money can be used. But the idea, I think, is just that they want to make care better in areas where there isn't good healthcare right now.
Marianne, of course, the focus is rural, and one wonders, even with money, can rural providers hire the staff they need to make these projects work? In the halls of the folks, after the meetings and whatnot, of the people that you've listened discuss this, is there a concern about workforce, and especially rural workforce here in North Dakota, to support this expansion?
Yeah, I think it's really hard because, like I said before, they can't use this money to replace funding for existing programs, and the money is supposed to be used for stuff at the same time that could be sustainable past the span of the grant. And so I think sustainability is kind of going to be a tricky thing, and that probably also applies to workforce. I know that the money can be used for a number of things that could improve workforce, but you know they're trying to kind of do all of these things as at once. So I sort of see what you mean. In order to stand up anything that they want to use the money for, they're going to need more people, but part of the money is also supposed to be dedicated toward getting more people.
Mary, as we wrap this up, there was a comment that North Dakota Senator Hoeven made. He said that we're ahead of everyone. Where does the state stand? And what ground do we have make up? And what's your sense of whether we really are ahead of everyone as we go down with every other state in the country this road of sustaining these funds with the rural health program?
Yeah, I don't know. It's hard for me to really say. I do know that when it comes to the amount of money other states received for their applications, North Dakota was sort of dead on average. The average was about 200 million, and North Dakota received 200 million for the first year. Um, but when it comes to money per capita, we scored fairly well. I think we were number six in the country, but then again, uh, 500 million is sort of the baseline, regardless of population, that states are expected to get over the span of the program. So, part of the reason we did so well per capita is just because we have fewer people than most states.
That's Mary Stoyer. She's with the North Dakota Monitor, and this is the second episode of A Closer Look with the Monitor. She's been following the latest developments in North Dakota's push to transform rural health care. Lawmakers return to Bismarck next week for a special session that will determine how that nearly $200 million in federal funding will be deployed and how the state positions itself for even more support in the years ahead. You can read Mary's reporting without restrictions or firewalls and follow updates throughout the week at northdakotamonitor.com. Mary, thanks for joining us today.
Thank you.
We bring in Amy Dalrymple, who's the editor-in-chief of the North Dakota Monitor, North Dakota State's newsroom outlet. She joins us periodically on A Closer Look with the Monitor to share what she and her team are working on and to highlight the stories readers should be watching for at the Monitor. Amy, what's your team working on for this upcoming special session?
Well, at this point, we know about 5 bills that will be introduced in the special session, the one bill that relates to the federal rural health funding, and 4 policy bills. The one proposal that could draw some debate next week is the bill that would give pharmacists more authority to prescribe medications for certain conditions. The big unknown is we still don't know if any other bills will be introduced. Legislative leaders did not make any decisions on that this week and are expected to talk about it on Tuesday afternoon, less than 24 hours before the session starts. Lawmakers who have proposals that they want to introduce are supposed to make 5-minute pitches to legislative management about their bill and why it's an emergency issue that can't wait until 2027. One of the ideas that will be pitched is a bill to provide free school meals to all K-12 students, similar to the ballot measure that's circulating. We don't know yet what other topics might be pitched. So we'll find out a lot more on Tuesday as we're covering that meeting. In 2023, the last time North Dakota had a special session, they followed a similar process and legislative leaders said no to almost every bill draft.
Amy, thanks for that. Will the public have much time to weigh in?
Because things are going to move quickly next week, the opportunities for the public will be rather limited. So if you want to be engaged, you're really going to have to pay attention. I suggest watching the North Dakota Monitor website, particularly on Tuesday afternoon and early evening. That's when we'll be able to report on any new bills that will be allowed in the special session. Hearings are scheduled to start at 10:30 a.m. Wednesday. So if they do allow any new bills, that's a pretty short window for the public to reach out to their lawmakers or submit testimony. The legislature will be accepting remote online testimony from the public during the special session. The session is expected to take 3 days, although lawmakers could choose to meet longer. If they keep the focus on the rural health care funding, I expect they could even wrap up early on Friday. If they decide to bring in other topics, I think we could see some long days next week.
So, Amy, besides the legislature's special session, of course, that'll take a lot of oxygen. There's also an important speech from Governor Armstrong. Tell me more about that.
Yes, right as the special session gets underway, Governor Kelly Armstrong is going to be giving a State of the State address. His office indicated that it's likely going to be focused on his executive order, which called for this special session.
That's today's update from A Closer Look with the Monitor. Our thanks to Amy Dalrymple for sharing what's ahead for the North Dakota Monitor. And you can find new episodes and follow along every Thursday here on Main Street and every Friday at northdakotamonitor.com or wherever you get your podcasts. Amy, great to visit with you, and we'll look forward to chatting as the special session will be underway next week.
Thanks, Craig. Great visiting with you as always.